So I had a patient come in and she was frustrated. She said people were constantly asking her if she was okay, if she was mad, if something was wrong. And she's like, I'm fine. This is just my face. Classic RBF, right? Resting face that reads as angry or tired when you're actually perfectly content. And she assumed the fix was Botox, which makes sense because that's what most people think of first when they think of Botox. But when I looked at her face, Botox wasn't necessarily the only issue. Her eyebrows were fine, her forehead was fine, there was no tension there. The problem was the corners of her mouth were turning down slightly. And that tiny downward angle at the mouth, it changes your entire expression. So instead of doing Botox, we did a very small amount of filler in the corners of her mouth. Just enough to give a subtle lift so her mouth sits in a more neutral or slightly upward position. But yes, you can do a little Botox there too. And so we also added a little bit of Botox in the DAO muscle, right around here, the depressor angular oris muscle. And so that will also help lift up the corner of the mouth as well. So we did a combination of both, some filler and some Botox. And the result, she looked softer, more approachable, but still completely like herself. No frozen face, no overdone look, just a small adjustment that made a huge difference. Here's what I want you to understand. Not every concern is solved with Botox alone. Sometimes it's about the volume, sometimes it's about placement, sometimes it's about understanding the facial anatomy. If someone's telling you that they look tired all the time and you're sleeping fine, there's usually a reason. Maybe it's hollowness under the eyes, maybe it's the mouth corners, maybe it's something else entirely. You shouldn't have to walk around wondering why people think you're mad when you're not. If this sounds familiar, send us a message and let's figure out what's actually going on and what we recommend as the best treatment for you.